Oh, let's see. Make sure that it's running. All right, we're in business here. How's it going, everybody? Dr. Patel here. Thank you for visiting our Facebook Live. We are continuing on our discussion about the hands and the wrists, and we're going to be focusing again this week on carpal tunnel syndrome. Last week we talked about carpal tunnel and what is it exactly, what causes it, and what are the symptoms that are associated with it. And today we're going to be doing a little bit of physical examination and a diagnostic ultrasound so you can see exactly what is it that I do when you come and visit me in the office to figure out if carpal tunnel is the thing that's causing your symptoms. If you like this video, please like it, share it, and if you have any comments or questions, feel free to send us a comment or a DM, or you can email us at info@fxregencenter.com. If you have any other topics that you want to talk about, or if you have questions about your carpal tunnel syndrome, then please reach out. Without further ado, we're going to get started with the physical examination. So, as we mentioned last week, carpal tunnel syndrome involves symptoms that go into the hands, and typically it's like numbness or tingling, or that you have the sensation that you need to shake your hand out. Sometimes you can have difficulty with fine motor skills, like dropping objects, or problems with keys, problems with door handles, or gripping or opening jars, things along those lines. Sometimes it could be pain going into the fingers, or it could just be numbness or tingling. Even numbness, like you can't feel, could be a part of carpal tunnel syndrome. So there's a lot of other things that can cause these symptoms, though, such as issues going on with the neck. So for that reason, when I do a physical examination of someone that I'm suspicious that carpal tunnel might be involved, I also look at other things such as the neck, the shoulder, the elbow, etc. So when I see a patient like this, I, for argument's sake, we're going to say that the right hand is the one that has the symptoms. I'll still be examining the left side as well, just to kind of compare things. First and foremost, I'll look at the hands and I'll see, I'll inspect and see, all right, does the muscle mass look similar on one side compared to the other? Particularly the muscle mass around the thumb, okay? Because the median nerve that travels through the carpal tunnel is in charge of some of the muscles of the base of the thumb, which is called the thenar eminence. And if that nerve is significantly irritated or damaged, then those muscles in the thenar eminence can actually get atrophied or decrease in size. And that's something that we want to pay attention to, both visually and by pressing and palpating in that area. We can see, is there some atrophy of those muscles or not? From there, after inspection, I would do some palpation or pressing in the area, because again, the various different pain symptoms you may feel here, things like arthritis of the thumb joint, as we discussed a few weeks ago, could be a piece of the puzzle. So I will press and palpate various different areas like the thumb joints to see if there's any pain that's elicited by that. I would move on from there to go look into various things like your range of motion and see what the flexibility is like in the hand. But then I would go on to some neurological testing. And this is where the testing involves not only potentially the carpal tunnel, but also looking at, is there any nerve irritation coming from the neck? So I would start with some motor strength testing, when I would have the patient bring their arms up, and then bring their arms in this direction, and in various different positions, I would have them pull up against me and see what their strength is like, bring their arms straight, bring their wrists up, and push up against me, seeing what that strength is like, push against me here to see what that strength is like, and ultimately seeing what the strength of the hands are like as well. So I would have them grip my fingers, and I would try to take my fingers out from the grip and see, is the grip strength decreased? And if it did seem to be decreased, then I would have them flex their fingers and see if there's weakness in any particular fingers. Because as we talked about last week, the median nerve goes to these fingers more than these fingers. So if he was bending his fingers here and we found weakness here but strength here, then we can say, all right, maybe the median nerve is involved in this area. After testing for motor strength test, I would test for sensation. So using just light touch like my fingers, I would test in different areas of the arm to see if there's any change in sensation on one side or the other. I would also use these, what look like torture devices, but these little pinwheels essentially are testing different types of nerve signals. And I would do this on various different areas to see, again, if there's a side-to-side difference. And we can see, based off of the pattern of decreased sensation, if there's a nerve irritation coming from the neck versus if there's nerve irritation coming from the hand. If this is carpal tunnel syndrome, what we sometimes see is a change in the sensation on the fingers on this side, which is the ulnar nerve, versus this side, which is the median nerve. And we can even see a splitting of the ring finger, because the thumb side of the ring finger versus the pinky side of the ring finger can be different. The thumb side of the ring finger is from the median nerve through the carpal tunnel, and the ring side of the ring finger is from the ulnar nerve. So if there's a difference between just the two sides of the ring finger, that could be a sign that the carpal tunnel is involved. So I'll go on to various other things, including testing for reflexes, but then I would go on to doing some more provocative maneuvers to really see if I can elicit some irritation to the nerve at the carpal tunnel. There are various different tests for seeing if the nerve is involved, one of which is even just doing compression of the nerve at the wrist, and compressing this area can cause numbness and tingling to go into the fingers if that nerve is irritated there. There are other maneuvers such as phalens and reverse phalens that really stretch or compress the nerve there. And there's a maneuver called Tunnels, in which you take an object, either your fingers or a percussion hammer, and gently tap at the nerve at the carpal tunnel. And just that tapping, if that causes some discomfort at the wrist, that's not necessarily carpal tunnel. But if that causes symptoms to travel into the fingers, then that is a positive test and is more suggestive of carpal tunnel being an issue. Okay? So putting all of that together, I could say, all right, how much is the neck involved versus how much is the carpal tunnel involved, or are both a piece of the puzzle? And from there, an extension of my physical examination is where we use ultrasound. Historically, to truly diagnose carpal tunnel syndrome, a nerve test called an EMG and nerve conduction study, or what's called electrodiagnostic testing, would be used to see how is that nerve actually functioning. So we could see with that kind of test if the insulation of the nerve is damaged, or if the copper wire of the nerve is actually damaged as well. And that nerve is still a really good test at seeing if the nerve is functioning appropriately. But over the course of the last few years, ultrasound has actually been used as a great tool to visualize the nerve and actually see what the nerve looks like. And number two, it has actually been validated as an appropriate way of seeing if the nerve is actually damaged. So with the ultrasound, we can actually take a look at what the carpal tunnel looks like and what the nerve looks like. So here's a visualization of what the carpal tunnel is, and what I'm going to point out a few different structures as we go along. This is the thumb side of his body. This is the pinky side of his body. And ultrasound, as we've discussed in the past, is sound waves that travel from this transducer and then bounce off of different structures and bounce back to the transducer. So this is the skin here. This is the soft tissue. This is the bone of the carpal tunnel, of the wrist. And this whole area right here is called the carpal tunnel. And you can see that the base of the tunnel is made by the bones of the wrist. The top of the tunnel, this line that we see here, is this soft tissue structure that is the roof of the carpal tunnel that's called the flexor retinaculum. And that tissue essentially is a soft tissue that goes from the thumb side of the bones all the way to the pinky side of the bones, and it acts as a support for all the structures that are inside the tunnel. And in this tunnel, we have various different things. These bright white, kind of almost circle-looking things that you see here are the tendons that go to our fingers. Tendons are what attach muscle to bone, and these tendons are in charge of flexing our fingers. So if you could actually wiggle your fingers for us. So this wiggling of the fingers, you can see these tendons moving, and those are the tendons of the finger flexors. And then we have this guy right here, this darker circle that's almost more oval shaped. That's the median nerve. That's the nerve that can get irritated when we have carpal tunnel syndrome. Now when we look over here to this side, you see this guy that's pumping away here. That's actually the ulnar artery. And you can see, let's see here, that's a Doppler ultrasound there, so we can see that that's the artery that's pumping away with that visualization. Next to the ulnar artery is actually the ulnar nerve, which is the guy that goes to these other fingers. And you can see that these guys here are outside of the carpal tunnel. So when we have compression of this area, this median nerve can get irritated. The activities that we do that irritate the median nerve certainly can irritate the ulnar nerve there as well. But when we talk about carpal tunnel syndrome, it's this area and this nerve that's involved. So there's a few things that I do when I look at this nerve. I want to see, does the nerve look normal? Sometimes people can have a nerve that's actually split into two. Sometimes that nerve could be compressed by not only the tendons that are inside here, but if somebody's muscles actually go invade into that carpal tunnel space, and that could be the muscles of the fingers or the muscles that are attached to the finger flexor tendons. So if you make a fist right now, and see how this black area kind of comes in to the tunnel there, and straighten out your fingers, and then make a fist again. So as he makes a fist, this black area comes into the tunnel. That's actually some of the muscle of his fingers over here, called the lumbricals, that are actually going into the canal as he's moving his fingers straight and bending. That's something that could cause compression to the nerve in the carpal tunnel, but typically the nerve gets irritated with repetitive activity. When the nerve does get irritated, that nerve can actually get swollen or inflamed. And when that nerve is swollen, that's something that's a sign that there's some carpal tunnel going on in one way, shape, or form. So how do we know if the nerve is swollen? Well, there's actually some measurements that have been tested in the research to show that certain sizes can actually play a factor. So I'm going to just freeze this image here, and then I'm going to measure that nerve and see what is the size of that nerve look like here. Let's see. So we are going to, this is a horrible tracing of this nerve here, but there we go. And we can see that this is actually 12 millimeters squared. Now, conventionally when we say that if the nerve is less than 10 millimeters squared in cross-sectional area, then that's a normal nerve. 10 to 12 millimeters squared is actually borderline. Above 12 millimeters squared is actually a swollen nerve that might be suggestive of carpal tunnel syndrome. So we got to ask the question, Adam, do you have numbness tingling into your fingers?
I don't have numbness tingling, but I've had a number of injuries to the right hand.
Okay.
And I've seen a physical therapist to do some hand-based exercises back when I was having some severe tightness in the hand muscles themselves.
Okay. So that might be a factor. You might have at one point in one way, shape, or form irritated that nerve, which has caused it to swell a little bit. The good news is it's not absolutely rip-roaring horrible. But it is something, when I have patients that are kind of borderline like this, we're in this, if he was having symptoms, then I would say, all right, hands down, that's something that we need to address. But even in the absence of symptoms now, with a history of trauma, it's something that we just want to pay attention to In other words, we don't want to do things repetitively that are going to cause irritation to this. And we do want to pay attention to if we feel things like our hand falling asleep or something along those lines. That's something that we want to get evaluated for sooner than later, rather than waiting until the nerve gets more damaged. Right? So this is a great way for us to visualize the nerve. See, is it swollen? Is it irritated? Are there structures that are causing it to be irritated? What's the anatomy like? But also, what does it look like in comparison to other areas? Again, if I was concerned in one way, shape, or form, I could compare from side to side. I could compare the nerve at the carpal tunnel compared to right before the carpal tunnel to see if there's swelling in one area or another. Ultrasound is a great tool for us to really get a deeper understanding of what's going on in the carpal tunnel, and the studies show that it's pretty much similar to doing a nerve conduction study or EMG nerve test at diagnosing if somebody has carpal tunnel syndrome or not. Ultimately, ultrasound is an extension of the physical examination. Doing a thorough physical examination plus an ultrasound, we can really get down to the bottom of what's causing your symptoms. So I hope that all made sense. I really hope that we were recording this whole time. It would really suck if we weren't. If there were any issues or something, you just let us know, and we can always try to record this again if need be. But if you have questions about your symptoms, feel free to comment. I'm not looking at the comments right now, so I'll get back to them as soon as we are done recording. Or you can drop us a DM or email us, again, at info@fxregencenter.com. If you like this, please share it. And again, if you have other topics that we want to discuss, by all means. We are going to be switching either next week or the following week to discuss things about the ankle and foot as well. So stay tuned, and I hope you enjoyed. Have a great weekend, and we'll see you next time.